How did ancient doctors diagnose headaches without modern tools? Imagine living thousands of years ago when doctors had no fancy machines or blood tests to help them figure out what was wrong. How did they do it? Well, they relied on their sharp eyes and listening ears. They would ask patients to describe their headaches in detail. Was it a dull ache or a sharp stabbing pain? Did it stay in one spot or move around? How long did it last? Did anything make it better or worse? They paid close attention to all these clues. Ancient doctors also watched how people behaved during their headaches. Did they look pale or sweaty? Were they irritable or quiet? Sometimes they looked for signs like nausea or dizziness. If someone saw flashes of light or had blind spots before the headache, that was a big clue too. These observations helped them understand what kind of headache it was, like a migraine or a simple tension headache. Back then, many cultures believed headaches were caused by spirits or demons inside the head. They thought that evil spirits caused pain and that the only way to fix it was to release them. Some doctors performed a procedure called trepanation. This meant drilling a small hole in the skull to let out the spirits or relieving pressure. It sounds scary today, but they believed it helped. Greek doctors like Hippocrates made important discoveries. They noticed that some headaches affected only one side of the head or one. They also saw that visual disturbances sometimes came before the pain. Hippocrates suggested that headaches could be linked to physical activity or digestion. If someone vomited, it might help ease their pain. He used careful observation and patient stories to understand headaches better, instead of relying on superstitions. In other parts of the world, like Persia, doctors classified headaches into different types based on how they looked and felt. They kept detailed notes about each patient's symptoms. They used herbal medicines, physical therapies, and sometimes mineral or animal-based remedies to treat headaches. Throughout history, doctors depended on talking to patients, watching their reactions, and noting patterns over time. They believed that understanding the story of each headache was the key to diagnosing and treating it. Even without modern tools, their careful attention to details laid the foundation for how we now diagnose headaches today. Their methods reminded us that listening and observing are powerful tools in medicine.